Hello friends, today we are going to discuss about Cluster C Personality Disorders as per DSM-5. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about Cluster C Personality Disorder. Those are Anxious Avoidant PD, Dependent Personality Disorder, and Obsessive Compulsive Personality Disorder. And in this video, I'll also discuss about prevalence and management of Cluster C Personality Disorder. Let's understand what is this Cluster C Personality Disorder. These are group of disorder where they are characterized by anxiousness, avoidance behavior, and fearful behavior. They usually begin at adulthood. There are three types of Cluster C Personality Disorder: anxious avoidant, dependent personality disorder, and obsessive compulsive personality disorder. Let's look into each one of them. First and the foremost is anxious avoidant personality disorder. In anxious avoidant personality disorder, you can see a pervasive pattern of social inhibition, feeling of inadequacy, hypersensitivity to negative evaluation, and present in various contexts. And they should have at least 4 symptoms out of the 7. Let's look into these symptoms. They avoid occupational activities that involve significant interpersonal contact, and they have fear of rejection, criticism, disapproval. They are also unwilling to get involved with people unless they are liked by everyone. They show restraint within the intimate relationship because of fear of being shamed or ridiculed. They are preoccupied with being criticized, rejected in social situation, and they also inhibited in a new interpersonal situation because of the feeling of inadequacy. They feel they are not socially inept, personally unappealing, or inferior to others. They are unusually reluctant to take personal risks or to engage in any new activity because they feel they may embarrass themselves in the public forum or in front of others. The pathognomonic feature of AAPD is social inadequacy, feeling of inferior, fear of social rejection. It is one of the leading risk factors for severe depression, anxiety disorder, substance disorder, eating disorder, chronic pain, and it is frequently underestimated and underdiagnosed. Let's look into the dependent personality disorder. Again, in dependent PD, it is a pervasive and excessive need to be taken care of to the lead to be submissive and clinging behavior to others, fear of separation, and present in a variety of contexts. They should have at least 5 out of the 8 symptoms. Let's look into each one of them. They have difficulty in making everyday decision without any excessive amount of advice and reassurance from others. They need others to assume responsibility for most of their area of his or her life. They have difficulty in expressing disagreement with others because of fear of loss or support or disapproval. Note, they do not include unrealistic fears of retribution. They have difficulty in initiating projects or doing things on their own. This need to be kept in mind. They go to excessive length to obtain nurturance and support from others, to the point of voluntarily doing things to others and that are unpleasant for everyone. They feel uncomfortable or helpless when alone because of exaggerated fear of being unable to care himself. Urgently seeking another relationship as a source of care and support when a close relationship ends. There is unrealistic, preoccupied with fear of being left alone or left alone to take care of themselves. Let's understand obsessive compulsive personality disorder. This is again a pervasive pattern of preoccupation with orderliness, perfectionism, and mental interpersonal control at the expense of flexibility, openness, and efficiency. They need to have at least 4 symptoms to diagnose OCPD. First and the foremost, they are preoccupied with the details, rules, list, order, organization, or schedules to the extent the major point of the activity is lost. That means They get lost in the details. They show perfectionism, that interference in the completion of tasks. That means many a time they are unable to meet the deadline. They are excessively devoted to work and productivity to the exclusion of leisurely activities and friendship because they need to be doing it perfect 100%. Hence, they sometimes sacrifice their leisure time. They are overconscious, scrupulous, inflexible about the matter of morality, ethics, or values. They are unable to discard worn out or worthless objects even when they are having no sentimental values. They are reluctant to delegate tasks or to works with others unless they submit exactly the way they want to do. For them only they will delegate their work. Otherwise, they do that work by themselves. Adopts miserly spending style towards both the self and others. Money is viewed as a something to be hoarded for future catastrophic events. They show rigidity and stubbornness. Let's look into the prevalence of Cluster C personality disorder. If you look into anxious avoidant, it is between 2.5 to 5%, dependent PD is 0.4 to 0.6%, and obsessive compulsive personality disorder is 2 to 7.9%. Let's look into the management. If you want to differentiate between AAPD and social phobia, anxious avoidant personality disorder is adolescent onset, pervasive, present in almost all contexts of life. They feel inferior, they feel they are not socially inept, they are inadequate, they are incomplete in all relationships, and even in one to one relationships. They have poor insight into their feeling of insecurity and worthlessness. Whereas, on the other hand, social phobia is specific to social situation. With regard to performance, they will lose control in front of the public, and they will be embarrassed in front of other people. Invariably, they avoid social interactions. However, they do well in one to one situation. That is the marked difference between AAPD and social phobia. With regard to AAPD, there will be constant anxiousness, whereas in social phobia, the anxiety is seen only in a social situations. Let's differentiate between AAPD and GAD. As I mentioned, AAPD is a adolescent onset, pervasive anxiety, feeling of inferior, not complete in all relationships and even in one to one relationships. They have poor insight into their feeling of insecurity and worthlessness. If you look into the generalized anxiety disorder, they have a constant worry, feeling on edge. They are excessively worried about day to day event and they expect negative outcome of each event. They are unable to relax. They will be in a constant worry and also fidgety moments. If you want to differentiate between OCPD and OCD, in OCPD they are preoccupied with the details, rules, regulations, morality, ethics, and this is seen in almost all areas of life. And they may be successful, but their relationship with other people will be hampered. And many a time they are able to meet the deadline. Whereas in OCD, they will have repeated unwanted thoughts which are observed. They are clearly able to say these are all unwanted thoughts and they are accompanied by compulsive behavior. Here also the patient says, I don't want to do this, but I'm compelled to do this. They are time consuming and they do not complete any event by deadline. That means many times you can see avoidance also. Most of the time, patient or a person with OCD will have disability, and many a time the family members also suffer miserably because of accommodative behavior of obsessive compulsive disorder. Let's look into the challenges in diagnosis. Unfortunately, the APD and social phobia go hand in hand. GAD and social phobia, it's very difficult to diagnose and they complicate the course and outcome of APD and other disorders. With regard to OCPD and OCD, the presence of both of them will have a poor outcome. Let's look into the diagnosis of cluster C PD. First and the foremost, detailed evaluation, clinical interview, observation, MAC, and collect collateral information. You can also consider doing projective test. Other general personality disorder assessment scales such as PI, that is Personality Assessment Inventory, structured clinical interview for DSM-5, that is SCID-5, Minnesota Multiphasic Personality Inventory 2, Million Clinical Multi-Auxiliary Inventory 3, Personality Diagnostic Questionnaire 4. With regard to AAPD, you can consider Adult Attachment Projective Picture System, Experience in Close Relationship Revised for AAPD. For Dependent PD, you can consider Dependent Personality Disorder Scale and OCPD, Obsessive Compulsive Personality Inventory. Scales can be used. The treatment of Cluster C personality is challenging to anybody. Unfortunately, we have only few RCTs and few open label trials. Hence, it is very difficult to give any recommendation with regard to evidence-based treatment recommendation. And invariably, SSRIs and CBTs have been indicated for presence of comorbidity and treatment of comorbidity. A meta-analysis by Simon in 2009 specifically said that Cluster C personality disorder treatment, the cognitive and psychodynamic therapy is the treatment of choice, and they have large and medium effect with regard to outcome. There are few open label trial with regard to DBT, group therapy, and social skills training in Cluster C personality disorder. However, World Federation of Society of Biological Psychiatry guideline treatment recommends that SSRI can benefit Cluster C personality disorder based on various studies on anxiety disorder, OCD, depression. That means when a person with Cluster C personality disorder also have depression, when you give SSRIs over a period of time, even they have noted that personality symptoms or trait also decrease. Medications are very useful, especially in comorbid conditions, but have a little effect directly on the personality disorder. To conclude, my dear friends, Cluster C personality disorder or comorbid with depression and anxiety is very common. Comorbidity is the rule. In Cluster C personality disorder, there are hardly few studies with regard to treatment of Cluster C personality disorder. Available evidence indicates towards CBT and psychodynamic psychotherapy. Thank you very much for giving your valuable time. Stay safe.